The other very important issue that I will comment on, or want to comment on, is not just the issue of the phase 3 randomized trial of progression-free survival, but in fact the new paradigm that we have, which is basically precision cancer medicine. And when you have a situation where you're dealing with a relatively uncommon cancer like ovarian cancer, you can do randomized phase 3 trials. They've been done for the last 40 years. You might even be able to randomize phase 3 trials if the population we're talking about was a half or a third or maybe even a quarter of the population. But if you're talking about 5%, 3%, 2% of patients where it makes sense, the likelihood that you're going to be able to do a phase 3 randomized trial, or at least do a phase 3 randomized trial that's finished within a decade or 2 decades, and I'm being facetious because of the absurdity of the situation, makes no sense. So we have to come up with other strategies to evaluate efficacy. So my point here is not that we don't have to do clinical trials, and not that we don't have to do rigorous clinical trials, absolutely, but the idea that the only way to move a drug forward into the non-research domain, into the standard of care domain, is a phase 3 randomized trial in the era of precision cancer medicine, which we're in, and it has been spectacularly successful. We've got to come up with a novel approach. Now those could be looking at high objective response rates. So those could be looking at time to disease progression compared to a well categorized historical control. It could potentially be having a patient's own natural history of disease characterize their time to progression such that if they went on this novel therapy and the time to progression was 50% longer, 100% longer, that would have to be due to that therapy. There are a variety of ways we can look at this. The point is, we've got to come up with strategies that are acceptable to the regulatory agencies, to the insurers, and obviously ultimately to the patients who are going to be receiving these therapies as it makes sense for them.